Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning, Dr. Mencia. I'm so
good
glad
morning,
you brought
Anita.
the sunrise again. You
always bring
sunrise.
that. Yes.
Did you see the moon the other night? It was like,
Yes.
oh my, it was like
Huge.
beautiful too. It was like
even last
gold.
night.
Yes.
Those are the days you want to live by the beach. And,
Yeah.
just lay down and play a guitar and open a good bottle of wine.
Okay, and that reminds me, we want to be careful.
Talking about drinking.
Yeah, that's right. That's right. But when we talk about going to the beach and having, been exposed, you were talking about.
Yeah, a lot of people come here, Anita, for the summer from up north. People need to realize that when they go back, and they listen to us still via the internet when they are up there, when they go back up north, before they leave Florida, they should check their body from head to toe to look for any skin abnormality that they are concerned with. It's like we say for skin cancer, the A, B, C, D, E. A is for asymmetry. That means when you look at a lesion in any part of your body, it's asymmetric or the left to the right, the top to the bottom. If it's symmetrical, likely that's a benign lesion. B is for the borders. Now, a benign lesion has very smooth border, like a pimple. Right? It has smooth borders around. A malignant lesion, a cancer, usually you have these little feet sticking out because it's aggressive, it's trying to grow. The C is for the color. If the color usually is homogeneous, we say all brown, all black, all light brown, most likely it's benign. But if the color is mixed brown with dark black color, bumpy, so those things give you an indication more of cancer when the color is not the same all across the lesion. Okay, so you want to look at the diameter is the D. Diameter, basically what you want to do is take the eraser from the good old pencils, and if the eraser can cover the lesion, most likely it's benign. The lesion is kind of small. If the lesion comes outside the pencil, then that goes to the malignant side because it's a big lesion. But don't forget the other part about color and symmetry, and they all have to add up. It's not like if you have one of the five, then you are in trouble. So look at the skin. And the other thing, we tend to look at the skin, we look at what other people see. We look at the back of our hand, we look at the face. We might look at the neck, especially a female. A male, if they wear suit and tie like me, they probably won't look at the chest. Now, when it comes to checking your skin, we're talking about your entire body, including the bottom of your feet. Because a lot of times when the person gets one of the most aggressive skin cancer, it's a melanoma. The melanoma can be between your toes. It can be at the bottom of the feet. So if it's on the sole of the foot, some people, it looks like a nice, beautiful pimple. It's so romantic, so beautiful.
A beauty mark.
It's a beauty mark. And it is not. So look at your whole body and think that you know that you didn't have there. If you're going up north, make sure you get a check. If you're still going to be in Florida and you have a primary care doctor, get a check.
Or go to see Dr. Mencia.
Or come to my center.
That's right, at the AGI Center. So maybe it's a good time for me to do that. Their website is agifl.com. Make sure that you review that because we We have a lot of exciting things coming up. And, of course, if you are still here, why don't you make an appointment and just go see Dr. Mencia? It'll really be a wonderful thing to get yourself taken care of. And so the way to talk to them is just call, make an appointment, go meet Dr. Mencia. That in itself is wonderful. The phone number is 954-489-1345. 954-489-1345. Well, we got over that, but now I have a bigger question. Are we finished with skin cancer?
We are good. Okay. We are good to go.
Zika. I'm going to go and get my flu shot. We can start with that because you told me the flu shots are in.
They are in.
They're in.
The truck had just arrived.
The truck arrived with the flu shots. Well, it's interesting that how many flu shots do you really get when you get an order in? You get a lot?
We get a lot because, remember that we opened the home visiting center. So we do home visits from West Palm Beach all the way down to Miami.
Wow.
So it's a tri-county business. So all of those patients we serve have to be provided with a flu injection.
How do you store those flu shots?
We refrigerate them.
You must have a very big refrigerator.
We have several of them to store the different type of vaccination that we get. So also we cover some of the retirement communities. Dr. Pham, who is also a geriatrician, has been with me for over 15 years. I know him since he was that little. No, I remember when Dr. Pham came for his first interview with me. And I said, come on, let's go to the hospital and start making round. It's Vietnamese, so, Vietnamese has that young-looking face. So he started making round with me in the hospital, and the patients started like, oh, you brought your son with you. Oh, you brought your son.
Well, that's funny.
Okay, that's it. You are not hired. You are not hired. You're gone.
Oh, that is very funny. So, but
Dr. Pham got to retirement community. And he see patients at the retirement community.
That's great. Now, how does that arrange? You make the phone call and you just have them.
Usually, we call for the community patient to come in.
Yeah.
For the people to come in, they just call the office and find out when it's a good time.
And then everybody would be in a room there, and everyone gets their flu shot.
Everybody get their flu shot.
That's a wonderful thing that you're doing.
And they sometimes some of my patients they joke around. They say this shouldn't be AGI. It should be Jimmy John. Because we are Jimmy John fast.
Right, Jimmy John fast.
Some patients go. It should be called Indianapolis 500. Because if you know that the race car, when they pull aside,
yes,
everybody jump in the car and get a car out. So our patient, one of the things that I noticed when I first came to Florida, and I studied the market about opening a geriatric center here, I started going with my family member, my uncle and what have you, to their appointment to see what was the process here. And I remember going with my uncle to his primary care doctor. Oh, my God, we waited like 3 hours in the waiting room. And the waiting room was packed. Mm. And then they finally called us into the room, and we waited for another 45 minutes inside the room with the door closed and cold. I said, wow, this is no good. Mm. This is no good customer care. So as I go to different offices, I say, I guess the attitude here in Florida, because New York is not like that. I say, I guess the attitude here in Florida, these are all sick people, and they have no choice but to wait.
That's terrible.
I say, I have to change that.
And you have. It's rare that you see a lot of people sitting in your waiting room.
Absolutely.
They're there, but they get in pretty fast.
Yes.
I know I've noticed that. And
you notice the front, we don't have a window in the front, so, we don't have that separation between staff and patient. We are all a team, and the patient is part of that team. We don't have a front desk receptionist. We have a front desk concierge person.
Yes.
The concierge person, like when you go to a hotel, they greet you. Do you need water? Can I help you with anything?
Yes, you do.
They escort you back to your car if you have to. They open the door for you. It's a true concierge service.
Right. No, it is. It is true. Well, I've been waiting for you to come this morning for more reasons than because I love to see you, but I'm very confused about the Zika mosquito. And we hear about it, and I, as an older adult, want to know if I got bitten by a mosquito now.
Are you pregnant?
No, I'm not pregnant. So, see, that's been the fallacy that we don't understand. It seems like it's only for pregnant women have to worry. Is that true?
Well, it can be sexually transmitted. So, and the problem comes, the damage had been done when a woman in the reproductive age with the virus get pregnant. The virus tend to attack the neurological system. So they tend to have a small brain. They are born with a small brain. They usually will not survive. So if a little kid that is not sexually active, or an elderly person that is not expecting to be pregnant, like you and I,
that's right.
We won't get pregnant.
No, I don't think so.
No, anytime soon. So.
Unless by a Martian who comes down here, you never know what
that would be so cool.
That's right.
I'd be walking around. Look at Dr. Mencia with his belly, 6 months pregnant.
Well,
he was the Martians.
They took him up to Mars and they brought him back, right?
Yeah.
But seriously, so
now as a society, we should worry. We have a lot of people in reproductive age. And I think we should worry. We should do fundraising. We should work together as a society, like we always do. And right now it's up in South Florida, Miami area.
Beach.
And it's a lot of Latin American country that come and they visit Miami. So probably that could be a route of expansion of the virus. But the thing is, we're gonna wait until you get to Mississippi and New York and Canada, So for our neighboring Canadian and the rest of the country, we should all work together as a nation to contain the virus in place.
But I want to get back to that. I was worried.
It's easy. It's the water.
Just that's wherever mosquitoes are. But also when you're walking, they say to wear long sleeves if you can.
Right.
Of course. But so an average person, if they get bitten by a mosquito, and they're not, going to be getting pregnant, or they're just a typical person with none of that, is it like any other mosquito bite for them? I mean,
yeah, absolutely, it is.
But how could it affect?
You get all the flu symptom from getting the virus because it transmits the virus to you. You're gonna get sick.
So you could get sick from
from the Zika virus, you will get sick. You get the flu-like symptom.
So you would get sick rather than just a bite from a mosquito.
Right, and then you treat it like a viral infection. You treat it with supportive care, a lot of hydration. But I tell you now, when I go to exercise, or I put mosquito repellent more now than before. Because, I don't want to get bitten. I don't,
I don't even use mosquito repellent. You're saying we should all be using mosquito repellent
long
now?
sleeve. We should all be cautious because, again, we want to contain the virus. We don't want to get a lot of cases here in the West Palm Beach area and keep pushing up north. We are in South Florida. We are very diligent on watching and taking care of the water, making sure that we kill the larva of the mosquito before it starts reproducing. So as long as we as a society do the right thing, and then after that remain vigilant, because remember, it can still come in the near future. So we need to, until it get contained and it's not become a pandemic, which is when the infection now is spread throughout the entire world.
Okay, so
you look at the Olympics, the whole world is there now in Brazil. So
it could really be spread very quickly. It can be spread very quickly. Most of those young people, of course.
And there's a lot of young people out there, going crazy.
So when we get bitten by a mosquito, which happens, and it's not a Zika, it's just a mosquito bite. But if we get bitten by a mosquito and all of a sudden we don't feel well, we think it's the Zika? How will we even know?
A mosquito bite is just a mosquito bite. They will, itch, and you put a little calamine or what have you,
Right.
and the
So,
itch
but
will
a
go
Zika
away.
is going to be
The
different.
Zika will give you the flu-like symptom. It give you like when you get the flu. You feel,
But it looks like a mosquito bite,
it will,
right?
yeah. You will get bitten by maybe a few mosquitoes if you go out places that you are not used to.
So should a person come to your office if they think they've been bitten by a Zika virus?
Yes,
Zika?
yes, because it can be sexually transmitted. So because of that, you wanna come and get checked, and I want to know who's your partner, and the symptom that you are having. Are you hydrating yourself? Taking Tylenol, and.
Is
You know,
that
keep an eye on the vital signs. The heart rate, because if you have, let's say, one of the symptoms with the flu, you can get tachycardia. Your heart rate can go really fast. So if you are a person that is already prone to a heart attack, we don't want you to get tachycardia. We want to prevent that with some medication to keep your heart rate under control.
okay? Well,
At least until you contain the viral and your immune system now had taken control of the situation.
thinking about what you've just said, there are people who are walking around, but they've been being treated with chemotherapy and radiation for cancer. There are a lot of
Exactly.
people who their immune system is really weak.
Thus, they have to make sure they wear long sleeve, long pants,
And spray with insect
and
repellent.
spray with the repellent.
Okay, well, I'm glad we talked about this because we're hearing it. Every news broadcast, we're hearing about the Zika, and now we heard it just went to Miami Beach. And so as long as we don't have to worry, abnormally that we're taking precautions and get rid of any standing water and probably I would think if we live around lakes, they might be a lot, very, very much.
Now, if you live around a lake in a community that has a lake, then you have to go to your administration to make sure, don't take it for granted, just to make sure they are taking the proper measurements to control any mosquito growth in the area.
I live in a community right around a lake too. It's a very big lake, and it's interesting.
If you go to a golf course, and they have lakes in there, and you are concerned, go to the administration and say, okay, what are we doing for just get involved. Get involved.
That's great.
If you live by the beach, you have no worry.
No, because it's an ocean. It's a
an
different.
ocean.
Yeah, it's different. But the intercoastal
The
would be.
intercoastal will be.
Yeah, that
even
could
though
be
the
also.
water move more in the intercoastal than a lake.
Exactly.
I just take, in the back of your house to have a tank full of water. The water that comes from the rain. Anywhere where the water stay stagnant and mosquito can grow, the larva can grow.
Amazing that we would have this out of nowhere. So I guess, but let's keep talking about.
Now, one thing that we need to consider is that because it's a viral, it will be fought by the immune system. So it will make sense to get your flu shot early this year because you are already getting your immune system ready to fight 23 strength of viruses, in your body. So, get your flu shot. If you have not had your pneumonia shot, and it's been over 5 years, and you are over the age of 60, get your pneumonia shot. If you have not had your shingle shot, get your shingle shot. And
but I'm going to have my flu shot, but you don't want me to have a...
Yeah, in this country, a lot of the pharmacy now, they are giving vaccination. And
I don't do that.
I don't agree with that.
I
think,
don't do that.
Unless your primary care doctor refuses to carry the vaccination, and it could happen, people with HMO and stuff like that, the doctor might say, it's not worth it for me to carry this vaccine here. And wait, lose money. So they will send you to a pharmacy. But we don't do that. We give it to the patient because we have to keep record of it. We need to keep record. And if something do go wrong, God forbid, something go wrong with the vaccination, your doctor will be easier to track what's going on and, go to the proper health department so we can track to see if it's a production problem or was just the red herring that, something happened to one of the patients. So we do give it ourselves. And, we are starting today, we are open to start doing the flu shot. So if you not have your flu shot, get it done.
Yeah, I got to get it done. I got to buy more vitamin D, too. I've just run out of it. But and one thing I'll say about the people who give your shots, I don't know who trained them, but I'm waiting for my shot, and they look at me. We did it.
We are talking, and they give you the shot.
It's amazing. Any shot I get from you, I had the pneumonia shot. I didn't even know he did anything.
They are great people. They are great staff.
Then there is a way to teach people to give shots.
And I spend time with them, to make sure that the services we are providing, is always the best. And I tell them, it's not about you, it's not about me. It's about you becoming a better person in healthcare, but it's always about the patient.
Yeah, that's you. I mean, the way you have always felt that, and everybody in your office feels that way. But I want to talk about the shingle shot. So one thing I haven't had, but you told me, have my flu shot first and then come back, in a month?
Right. Don't get some people that need the pneumonia shot and the flu shot and the shingle shot. Don't take more than one shot at a time, especially if you're over the age of 65. Don't do that. We do the same thing with kids because their immune system is very virgin. So we give them one, let the body accept that one, create all the antibody that we need, and then we go to the other one. Then we go, one at a time. So when you get in your immunization, I don't care about your copay or no copay. Don't be foolish trying to save money. Get your vaccination and get it done. Get it done right.
Well, I'd have to tell you that even the veterinarian, the vet does not give the dog all the shots at one time either.
Right.
They hold
Same
off
principle.
on some of them. They come.
Same principle.
So it just shows. But you're right. You have to be very careful. And it's funny how when people say, I'm not going to do that because, it cost me this much. But if you see what people do to spend money, I mean, health is the most important thing. That's where they should spend the money.
Well, that's right. That's right. That's, I had a patient that came in from Dubai and was in as a private patient for aesthetic. And, for him, money is not an issue. It's from Dubai. These people, this money was not a problem. He said, bring me all the product. And his hand, he's 86. And I look at his hand, I say, I can make your hand look younger. I say, you can? I say, yeah, there's a product we can inject in there, then we're going to spread it. But it might take more than one. He has big hands. He said, Dr. Mencia, I told you, money here is not an issue. Make me, he just got a girlfriend back in Dubai. Make me young. I want to be young. Fix my hand.
So he doesn't mind paying.
No. Sometimes when it's about you and your health and what makes you happy, don't pull back. Just, don't cut corners.
We're not cutting corners. I don't know how the time goes so fast, Dr. Mencia, but this was a good show on vaccinations and about the Zika. And I don't know what's happened to my voice. But I'm...
sexy voice.
Yeah, right, the sexy voice. But I want to tell you that I have had so many comments about people. When I go home now, someone will say, oh, I listened to Dr. Mencia, and they repeat exactly everything you've said.
Yeah.
So now we're going to have a whole thing on the Zika. Yeah. I have to listen to them all tell me about what you just said.
When we were talking about romance and love and at the end we say, well, spread the love.
Right.
Remember, spread the love.
Spread the love.
And it was funny watching the drug rep coming by the office and they, Dr. Mencia, spread the love.
I know. No, they do. They wait. They wait and they listen.
They do listen and they remember
really
what we have to say.
So I hope that you have a great week. I know you're going down right now to your office.
And the channel coming out, thanks to Richard. I'm going to have my own channel.
Yeah, you're going to have your own TV.
Richard, we're going to have our own TV channel.
Yes, we are.
Coming soon.
We're working on it. We're very close that we're going to do that, and you'll be able to see that anytime. You'll be able to see how glorious Dr. Mencia looks, and now your ties are not going to go to waste.
Yeah, now when I wear a tie, we can say, okay.
I just in the closing, I don't know what your closet looks like, but I sometimes like to see where your ties are all hanging. I bet your ties have a lot of fun at night when you're sleeping, all getting together.
But if I have a minute, do I have a minute? Yeah. I go and look at my tie, Rachel, like...
He's laughing.
Make sure they are aligned properly.
Okay.
And I have them color code, too.
Yeah. Color coded. Oh, my God. We'll know about that. Okay, Dr. Mencia, thank you very much. Phone number to call 954-489-1345.
561-270-6494
Oh, yeah,
in
we
Boynton.
don't want to forget that either. Okay, thank you very much, Dr. Mencia.
You're welcome.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.
AGI Medical and Dental Centers wants you to receive the finest and most personal medical and dental care in South Florida. Founded by geriatric physician Dr. Andy Mencia. They combine comprehensive and diagnostic medicine while providing personalized medical care for each patient. Now in 2 locations, Fort Lauderdale and Boynton Beach. Their medical staff is trained and dedicated to utilize the latest medical cutting-edge technology, along with listening skills to provide their patients with the best medical and dental outcomes. Here's some of their unique services. Second opinions for peace of mind and assurances of outcomes. Dental care by prosthodontists and periodontists, from the simplest oral cleaning to a full implant program. Medical professionals visiting and caring for patients who are homebound. Saturday office hours. Go to their website at agifl.com. Be sure to listen to Dr. Mencia and Anita Finley on The Wonderful World of Wellness each Saturday morning from 7 to 7:30 on WSBR Radio, 740 on your dot. To become a special patient, call AGI Medical and Dental Centers at 954-489-1345 in Fort Lauderdale and 561-270-6494 in Boynton Beach. Medicare and most insurance accepted.